Hello po and good morning. Thank you for joining us today. Ako po si Dr. York Bondoc. Our program is called Libreng Konsulta and today we're gonna speak about a super interesting topic. Ito po ay tinawag na pinakamasakit na sakit. So ano kaya yon? So please join us. I am an internal medicine specialist and a pulmonologist. I am also a three-term congressman, the wife of a mayor, kaya ako barangay matters, kayang-kaya ko yan, and also po the mom of an 8-year-old. Please follow us po on YouTube. We do have a channel and we would be happy kung sana po mag-subscribe kayo and mag-notifications din so you know kung may bagong video. Sa Facebook po, we do live at least 3 to 4 times a week and we will be happy po if you would follow us. Sa ngayong araw na to, kung kayo po, alam nyo sa tingin nyo kung ano yung pinakamasakit na sakit at may tanong po kayo, bakit siya masakit, ilagay lang po yung inyo pong mga katanungan sa baba in the comment section. We promise to read all greetings and all questions. So tara na po, alamin na po natin ang pinakamasakit na sakit. Okay, so I think I have guide questions. Ayan, ano nga ba ang pinakamasakit na sakit? Tinanong ko po doon, there were 4 choices. The first is cancer. The second is herpes zoster. The third is manganak ng walang anesthesia. Diyos ko, masakit yun. And the fourth is kidney stone. And actually po, acknowledged as one of the most masakit na sakit, as in talagang nagsiscreaming po talaga. Sabi po ng pinsan ko who got herpes zoster, she does not wish it po on her worst enemy. Ayaw na talagang. It was so bad, kahit sobrang galit siya sa'yo, she cannot na sana ma-herpes zoster ka. Malungkot, masakit, grabe. And this is what we call herpes zoster, also known po by the term shingles. Okay? S-H-I-N-G-L-E-S. Kung pakitype lang po, because it's known by 2 words, shingles, tama po yan, and herpes zoster. Zoster po. Now, how to pronounce? Para social tayo. Shingles. Okay? Shingles. Herpes zoster. Herpes zoster. Okay? Alright. So, ano ba nga bang herpes zoster, aka shingles? Ito po, this is it is caused by a virus. The virus is called the Varicella virus. Ito po, the Varicella virus, it is the same virus po as chickenpox. Okay? VZV ang tawag po in the US. Some people abbreviate it as letter V, letter Z, and letter V. Ano po? Varicella zoster virus. Para sosyalin. Doc, do I have a reactivation of the Varicella zoster virus? So, yun ho yung pronunciation. Okay? So, in case you have it, at least you know how to pronounce it. So it is considered po a reactivation of the Varicella zoster virus, VZV, or otherwise known po as the chickenpox virus. Okay? So, eto po, this is, I think we go on to section B, no? How is it related to chickenpox? And bakit po ito? Sige, sagutin na natin. Bakit ito yung pinakamasakit na sakit? Okay? Bakit sobrang sakit po ang herpes zoster? Kasi chickenpox is, ako ho, personally, I had chickenpox as a child, nakakainis lang po, but it wasn't that painful. So bakit ho, the hallmark of Varicella zoster virus reactivation or herpes zoster is 2 things. There is dalawa po ang markers nito. Number 1 is the herpetic vesicles, yung mga butlig-butlig po na parang matubig that appear in a band-like fashion, parang pagpahaba, okay? And the second hallmark po ng disease na ito is yung sobrang sakit po talaga. And actually, the pain sometimes comes before the vesicles, okay? Or the pain sometimes comes, mas masakit na, talagang may masakit na po, wala pa po yung mga butlig-butlig. So paglabas po ng mga butlig-butlig, kasama po yung sakit, and the butligs are in a band-like fashion, pahaba, no? Then you know that you have zoster. So, bakit po siya masakit? And why is it the hallmark po of Varicella zoster? Masakit po siya talaga because it is a disease that resides, nakatira po siya in the nerve endings of our body. They are hidden po in what we call po the dorsal root ganglion. Wag na ho nating puntahan yun, masyado na malalim. But eto na lang, they are living in the nerves. And the nerves po are the source of pain at lahat po ng sensations na mararamdaman po ng isang tao. So herpes zoster is frequently characterized by pain during the acute incidence po of the disease. At meron pa hong, kala mo tapos na, no? Pagkatapos ho ng herpes zoster, which will last between 1 to 3 weeks, may tinatawag pong post-herpetic neuralgia. That is the pain that happens after the herpes infection. So may pain na ho na acute pain of herpes at meron pa pong pain after the herpes. And the post-herpetic neuralgia can last for a really long time. At sa mga minamalas po talaga, it can months. So ano pong so the acute pain, sobrang sakit. As in sobrang sakit. Not your entire body, but along the length po. Kung saan po yung kahabaan po ng mga butlig-butlig, kasama po ng mga butlig-butlig is intense pain. Okay, intense pain. After the infection po, if you are one of those who will develop po what we call post-herpetic neuralgia. Neuralgia, no, that's a nerve pain. Ang ano po talaga niyan is aside from pain, throbbing pain, all kinds of pain po. Yung iba patusok-tusok, yung iba throbbing, yung iba po bigla na lang po ang parang kuryente. So many kinds of pain po. And then along with that is itching and burning. Kasi po, yung pagka-sensations po that are occurring in the nerves, it's not only pain, pero merong intense itching, grabe po talaga. There is parang burning pain, sobrang kate. So those po are the two, so there are two areas of pain in herpes, the acute pain and the post-herpetic neuralgia. So talagang it's a disease of pain. Ang hirap po, no? Post-herpetic neuralgia. The word neuralgia signifies that it's coming from the nerves. So if there is a disease of pain, eto na po yun. Okay? Next question. Ayan, this is the same virus as the chickenpox virus as I mentioned. And the question is, Doktora, how is this related to chickenpox? Okay, paano ba siya related to chickenpox? Ganito po yung sistema po kung ba't tayo nagkakaroon ng herpes. Okay, a lot of us, lalo na ho, mga kaedad ko, there was no chickenpox vaccine. Okay? So a lot of us developed chickenpox po as children. Ngayon, nawala na ho si chickenpox. Ano? Yung mga, mga 2 weeks, you don't go to school and you're filled with this parang patubig-tubig din po na blisters all over your body naman. Ano? Overall po itong chickenpox na to. As we recover from chickenpox, the chickenpox virus never fully leaves our body. Okay? Meron pong mga remnants. Ang hilig tayo sa remnants, parang COVID remnants. Basically ho, tatago po siya in the nerve endings of our body. Okay? They're hidden in the nerves. Ngayon, dahil malakas po yung immune system nyo, you are well, you are strong, the body keeps the chickenpox at a very, very low level. Low level lang po siya. Okay? Ngayon, as you get older, and this is very much related po to immunosuppression. The term is immunosuppression. Bumababa po ang inyong immune level. That can happen po with people who are older, 50 and above, people with cancer, people undergoing chemotherapy, people po who are undergoing po a kidney transplant, dialysis, diabetes, kidney disease, any disease po, nabababa po yung immune system, including major operations and stress. Bigla pong yung immune system nyo bababa and the body will lose parang the guardian. Yung parang binabantayan niya yung herpes zoster virus which is hidden in the nerves, biglang susulpot po yon. Okay? And the herpes virus will come back at lalabas po siya, unlike chickenpox po, which is throughout the entire body, ang ano po sa herpes is the band. Bakit band? Anong band? Bakit pahaba yung sinasabi ko? Ano? It will run along where your nerve runs. Okay? Halimbawa po, if it's in the chest, our nerves go around our chest, so paikot po yung band in your chest. Yung iba po, it's facial nerve, so pag ganito. Yung iba naman po, trigeminal nerve may affect the eyes. Yung iba po, running throughout, kasi ganito po yung nerve root sa kamay, running throughout your hand. dito lang po tatakbo yung vesicles. At kung saan po yung vesicles, nandun din po yung sakit. Okay? So that is how it's related to chickenpox. It's the same virus. It is no longer expressing itself as chickenpox. We consider it po a reactivation of the chickenpox, and it happens po because our immune system became low. Okay? So people always ask the next question. Our next guide point po, ayan. How do you get shingles or herpes zoster? Nakakahawa po ba siya? That is one of the most common questions na tinatanong po ng mga tao. Okay. I frequently, as a resident, encountered herpes zoster po sa hospital. And then, nakalagay, kasi like, for example, na-operahan, na-chemo, ganon, lumabas si herpes zoster. Ang nakalagay na ano po, signage dun sa room is contact isolation. What is the meaning of contact isolation? Yung vesicles po, nakakahawa. So, you cannot hold it. Okay? You're advised not to hold it kasi nakakahawa from the vesicles. Okay? Sinong nahahawa? Okay? So, when we enter, we are wearing a gown. It's not airborne. Okay? So, sino po ang mahahawa sa shingles? Ang nahahawa po talaga dito is people who have never had chickenpox before. So kung ikaw, if you're a nurse, no, and then you got exposed to herpes zoster and you never had chickenpox, what you will develop is not herpes zoster, but you will develop chickenpox. You only develop herpes zoster from your own body. You do not get herpes zoster from another person. Okay? Malinaw ba yon? And I will go back to this later. So if someone has herpes zoster in the hospital, ang worry po namin talaga dyan is contact. And ang dapat hindi po pumasok sa kwarto ay yung mga hindi pa na chickenpox noon. So, how do you get shingles? You get shingles from a reactivation of chickenpox. Nakakahawa ba ang shingles or herpes zoster? Mahahawaan po ang taong wala pang chickenpox ng chickenpox. Hindi po ng herpes zoster. Okay? Next. I thought I gave so. How to diagnose? Magandang tanong to kasi as I mentioned earlier, most of the time po, it's symptoms, presentation, at saka physical exam. So, anong meaning na to? Yung symptoms talaga, pwede pong aside from masakit nga yung band of vesicles, you can also have fever, tiredness, at saka po, pwede pong fever, tiredness, and mild pain. So, kuminsan po, no, sabi ko nga, biglang napapagod lang ho yung itsura ng tao, biglang may masakit, hindi mo magigets kagad na herpes zoster, lalo na kung hindi pa lumalabas yung vesicles. Once the vesicles come out in a band-like pattern with pain, person's feeling tired, immediately herpes zoster na po yan. Meron din pong PCR, we all know PCR, meron mga antibodies, but they are frequently not used. And doctors usually know herpes zoster when they see it. But again, if there is an intense pain in a certain part of your body, malaki po dapat, tapos kayo po ay may cancer, may stress, na opera, dapat po mataas ang suspicion level ng mga doktor that could be herpes zoster. Okay? So how to treat po, no? Pag na-diagnose po siyang herpes zoster, we give po antivirals. Yung mga antiviral, yung una po is acyclovir. I think I gave this, valacyclovir, and wait lang kasi I only give and falcyclovir. I think I sent this. Yan, acyclovir. So, these are antiviral IV drugs po. They really will not cure the zoster itself. Pero ang parati pong sinasabi sa amin is yung severity and duration po ng infection at saka ng pain maiiklian. So, it doesn't work like antibiotics, like biglang wala na. Pero if it was like 1 to 3 weeks, iikli po yung duration ng inyo pong nararamdaman about herpes. Did I not send valacyclovir? So anyway, it's acyclovir, valacyclovir, and falcyclovir. Most people po use valacyclovir kasi po 3 times a day na po yon. Acyclovir is very, very, very frequent. So most people do use valacyclovir. Okay? May bakuna ba? This is very nice kasi po, yes, there is now the bakuna of chickenpox. Okay? The bakuna po ng chickenpox or the chickenpox vaccine. If you never had chickenpox po, you should get vaccinated for the chickenpox vaccine even as an adult. Okay. Now, if you had the chickenpox naman as a child, there are two kinds of vaccines. Ano po? Yung Zostavax. Zostavax po, that's the live vaccine. We hesitate to give this to immunocompromised persons kasi po live siya. And we don't want na magkaroon po ng herpes, a mild chickenpox actually. Some people have developed mild chickenpox from Zostavax kasi nga live. There is an attenuated vaccine, yun po yung Shingrix. I don't think it's being sold in the Philippines, but it is available po in the US. So Shingrix po. Zostavax and Shingrix, may bakuna po talaga dito. And if you're elderly and you feel okay, you might consider getting po a vaccine kasi talagang as even age alone can cause you to get herpes zoster. Okay? Any others? Did we project all the words? So ano complications of herpes zoster? Ito lang if the herpes zoster is over your eyes, kasi meron pong bandang ganitong pababa sa mata, that's trigeminal nerves, it would be good for you to consult an ophthalmologist kasi po, pati yung mata nyo ma-affected, can be have dry eyes, very masakit po, and an ophthalmologist should be involved. Okay? Treatment po, as I mentioned po yung antivirals, but I did not mention this, there is a treatment po for the pain. People should not be left in pain alone. And talagang umaabot po talaga sa yung iba oxycodone na talaga kasi sobrang masakit. These are morphine-like gamots. And people also use gabapentin kasi or pregabalin kasi ito po ang nagtitreat po ng nerve pain. Okay, some people will drink neurobion but again, that will not help you sa sakit po talaga. So they usually two kinds, usually hindi na kaya ng paracetamol to or ibuprofen. So umaakyat po talaga tayo to the near morphine-like drugs and usually accompanied po by pregabalin or gabapentin. Okay? So there are two avenues of treatment po sa herpes, no? Treating the antivirals and then treating the pain. So, kailangan magkasama po yun. Hindi po pwedeng antiviral lang tayo. We forget the person is screaming in pain. Hindi po yun. There's also gamots po for severe itching. Yun po yung loratadine or claritine. And then, for the burning, talaga pong pain control po talaga ang kailangan dyan. Okay? So, let's take a look at some of our pictures. I made a few pictures so that you could see them po. No? Ayan, yan po yung chickenpox, I think it's too small But basically, the chickenpox is throughout the entire body. Yun at saka usually in kids, okay? Pero ngayon, may bakuna na po sa chickenpox. Alright, next. Ayan. Do you see why I made this? It runs along the hand, no? Yung band na yon, that is where the nerve runs. Ang herpes zoster, though there is a very rare herpes zoster that spreads throughout the entire body, majority po talaga ng herpes in the direction po or in the distribution of the nerve. Okay? So, kung kamay po yon, bababa yon because your nerve goes this way. Okay? Sa mukha po, may ganon. Sa ribs po, paikot. Okay? Forehead, yan po, no? Pababa po siya. This usually may involve the eyes and dapat po magpatingin sa ophthalmologist. Pababa po yan. Paganyan, no? Ayan. Okay? So, iyan na, as I mentioned, they live in the nerves. And that's why it's so painful po talaga. Parang ina-attack talaga nila yung nerve endings ng tao. Okay? So I think that's it. Our summary for today, herpes zoster is indeed one of the most painful diseases that can happen. Usually happens po in immunocompromised and older adults. It is a reactivation of the chickenpox virus. It is usually diagnosed through physical exam through the double presentation po of the band-like distribution of the blisters and the extreme pain. And it is treated with antivirals, and with, of course, pain control. Nakakahawa po siya sa mga tao, especially those who didn't have chickenpox before. And you can get vaccinated po now as an older individual po with 2 vaccines. Okay? Salamat po and magandang umaga.
From Miss Colleen Candy, saan po Dok nakukuha ang herpes zoster? Sensya na po, late po akong nakapakinig.
No problem, Colleen. You get herpes zoster if you had, first of all, it starts with getting chickenpox. Tapos gagaling ka sa chickenpox. Yung chickenpox magtatago sa nerves. Pero malakas ang katawan mo dahil bata ka pa. So your immune system is good. As you get older, maybe you get diabetes, dialysis, organ transplant, OR ng malaki, na cancer. Bigla pong yung immune system nyo hihina. Sa pagkahina po ng immune system, um, sa pagkahina po ng immune system, yung parang gwardya po ng inyong dating chickenpox, mawawala. So, uusbong po siya. Sa pagkausbong niya po, it will come out as herpes zoster and no longer po as chickenpox. Ayan. May request po dito na magbumati po tayo. Ayan. From Miss Darren. Sige, Reyna.
From Miss Darren Joyce Buwala Vergara, naranasan ko na po ang herpes zoster way back 2009. Super sakit talaga, doktora. Burning, itching, sumisigaw na po ako sa sobrang sakit. Sa nape po siya. Sa batok
Yes.
yata.
I would like to point out, thanks Darren Joy, I'd like to point out a few things dito sa sinabi niya, no? The burning, itching, and sumisigaw. Talagang, Diyos ko, Reyna, grabe. And then, ang nabanggit, another thing that I'd like to focus in on this comment is the nape, okay? Doon po, it follows a distribution. Hindi siya like all over your body. Okay? So thank you, Darren. It's really, really, really very painful. I'd like to share yung father ko po na operahan sa atay way back po, way back na, no? Umikot po yung herpes zoster all over his chest. It was dito po around, following the ribs. Ako, sobrang sakit, Reyna. Hindi makahinga yung tatay ko. You know, they had to call an anesthesiologist. One of the top anesthesiologists, Dr. Senon Cruz, who is actually the father pala of my classmate. So si Dr. Senon had to come in and give a nerve block. Ganon katindi. Nerve block ang inabot ng tatay ko. What is a nerve block? As in, they will inject anesthesia right dito sa nerves. Matindi.
From Miss Beth Taruk, nakakaawa po tingnan talaga ang may ganyan pag sumisigaw po sa sakit.
Beth, I really agree with you. It happened to my first cousin last month. Sabi niya talagang grabe. What I could say, no, Beth, the Philippines is magaling sa antibiotics, antivirals. Sometimes, some of our doctors do not put focus on pain. Ako po, I was trained in the United States at talagang sa amin, bawal po talagang masakit. So, sa amin talaga, and a few doctors who are aware na talagang dalawa ang targeting to. Number one, the antiviral, but very important number two, yung pain control. Nobody should be left screaming. Hindi dapat. At saka isa pa, if you don't treat the pain, and I just spoke to the pain specialist of my cousin, Dr. Henry Lu, St. Luke's Global. Sabi po ni Doc Henry, and kasi I was the one who told my cousin, ako, Diyos ko, pain doctor na. Kasi she had all these kinds of doctors na magagaling din, no? Yung infectious, yung sa mata, yung derma. Pero sabi ko, number one na kailangan mo, yung pain. And then, as I spoke to Dr. Luang, sinabi niya sa akin, ako, buti na lang tinawag ako ni Ana, ganyan. And you know why? If you don't treat the pain, it will just escalate and baka maging post-herpetic neuralgia pa yan that can last months. Okay? At pag nangyari yon, Diyos ko, laking at tagal na gamutan. So, once you're really feeling this, talagang aggressive dapat ho yung treatment ng pain. And medyo kulang dun po sa Pilipinas. At saka, as I mentioned, hindi ito paracetamol levels. Hindi ito paracetamol levels. Hindi kaya ng paracetamol ito. Baka mag-overdose ka pa ng paracetamol. You really need to tell Doc, kailangan ko talaga ng matinding painkillers. And then, aside from the painkiller, there is what we call po, it treats neuralgic pain. Yun po yung pregabalin or gabapentin. Actually, nung sa pinsan ko, I called her up. I said, you need gabapentin. Sabi niya, ano yun? Basta, kausapin natin yung pain doctor. Ayun po, pinigay. Isa pa. Um, as we treat pain po in herpes zoster, another component of the pain, no? Sinabi ko na nga yung analgesic, yung yung pregabalin or gabapentin. A third component po yung anti-anxiety. People now do give anti-anxiety meds kasi nakakababa din daw po ng pain levels. Siyempre, pag may pain, may anxiety. Okay?
Next po, Miss Kat. Dali po,
Okay.
nawala po yata si Miss Kat. Ako na lang po. From Gina Orbina Yambao Puno. I experienced herpes zoster last year lang po, doktora. Super sakit, di mo ma-explain anong klaseng sakit ang nararanasan ko banda dito sa likod. At nagkaroon ng mga peklat ang likod ko.
Yes, Miss Gina, thank you for sharing this. Truly, the pain is horrific. And number two po, the vesicles can sometimes scar. Tama po yun. But give it 1 year, kung minsan po nawawala din po yung peklat. Kasi it takes up to 18 months po for a scar to mature. Okay?
From Miss Gina Orbina Yambao Puno. 2 weeks po akong sumisigaw, doktora, dahil matindi talaga ang sakit. Tama po yung mga nerves ko, matindi ang sakit.
My gosh. Ano mo, Reina, these kinds of stories should not be allowed. Yung 2 weeks na sumisigaw, walang taong dapat sumigaw for 2 weeks, not even 2 hours. Kaya lang kuminsan talaga, no, sa Pilipinas, kulang tayo ng focus on pain. Ako kasi na-train ako sa Amerika. So when I heard my first cousin telling me, oh my God, ganun, ganun. I was like, okay, tapos na. We're calling a pain doctor.
From Miss
Ako lang ang kwentuhan ha. I'm not the doctor of my cousin. Nagkwekwentuhan lang po kami sa telepono. I called up her doctor. Sabi ko, Doc, hindi pwede to. Sabi niya, sige, tumawag ka na. So ako pa tumawag. But, lahat po kami nagtutulungan. She had excellent doctors. Ang problema lang talaga, sa Pilipinas talaga, sometimes we have all the kinds of doctors. Wala tayong pain doctor. So yun talaga, pain.
From Miss Gina Orbina Yambao.
Tapos na po si Ma'am
Okay.
Gina.
From Miss Gemma Abaricio.
Yung kay
Tapos
Ma'am Beth. Why don't you read Ma'am Beth about her
Okay
husband?
po. Miss Kat, please post Miss Beth. From Miss Beth Taruk, rugo ganyan po ang mister ko. Mula nung Feb till now, masakit pa din nararamdaman. May bakuna nga po siya sa ganyan.
Yes, Ma'am Beth, I would suggest you go back and ask for pain control. Hindi dapat tinitiis ito.
From Miss Beth Taruk, hilom na po ang sugat niya at nakarecover na po. Sa kanang bahagi po ng ulo at nadamay po ang kanang mata, masakit pa din daw po.
Ma'am Beth, baka napupunta na kayo sa post-herpetic neuralgia. Consult your doctor po, no? Because there is the acute pain, as I said, and there is the long-term pain. Ayaw natin mapunta sa long-term pain. Dahil, talagang, it's really painful. I would suggest po, kung you feel na talagang in pain, consult your doctor po dun sa pain control. Meron po. Pero as I mentioned, hindi talaga masyadong hot na hot ang mga doktor dito dun. Ako lang. And a few pain specialists.
Okay. From Miss Gemma Baricio Saturay, good morning, Doktora. Hindi po sa topic tanong ko po. Sana po masagot ninyo ano po ang dahilan bakit pumuputok ang ugat. Salamat po sa sagot nyo.
Ma'am, ang problem po dun sa tanong nyo, and this is what I would like to say that is wrong with the Filipino language. And what is the meaning of ugat, Reina?
Sorry, Doc. Ano po yun ulit? Medyo nagkakaroon po
Ano
ng...
yung meaning ng word or translation ng word
na ugat?
na ugat?
Bloodstream, Doktora. Mga bloodstream natin. Mga bloodstream veins.
Yun na nga eh. This is the problem of the question, okay? And hindi naman problem ni Ma'am Gemma to. But sa Pilipinas, sa Tagalog or whatever, ako ang meaning ko ng ugat is nerves eh. Wala naman ako alam na pumuputok na nerves, wala pa namang nangyaring ganon. But some people equate yung ugat with what? Artery, vein, ang dami. Kasi yung artery paalis sa katawan, yung vein pabalik. So may puputok na vein, may puputok na artery. So ano yung interpretation mo na sa tanong na yon? Pumutok na nerve, pumutok na artery, o pumutok na vein? And that's our problem po with the translation po sa Tagalog. Sa Tagalog po, there is no Filipino word for artery. At least I don't know. If you know it, share mo. There is also no Filipino word for vein. Parang ang feeling natin, ugat. Pero hindi ba ang nerves ugat din? So paano yon? We can't answer the question, Mom. You have to be more specific. Not because it's your fault, but because yung translation po ng ating language, hindi siya precise. How do I put this? Ano ba meaning nun? Wala siya exact translation. Wala nga tayong word sa aorta eh. O ikaw, Reyna, what do you think?
Yes, doktora, wala po tayong mga ganon. Malaking ugat, maliit na ugat.
Oo, hindi natin hinihimay eh. Sa US kasi, at saka sa ibang language, may malaking ugat, that is the aorta. And then there are arterioles, arteries, venules, pati yung mga major blood vessels may pangalan. Pati yung mga roots and nerves may pangalan. Sa Pilipinas, we lump them all under the term ugat. So hindi ko siya malaking ugat, maliit na ugat, medium na ugat, ugati, mini ugat. So what I'm trying to say is, ang hirap kasi sometimes, I really find it hard to translate. So Ma'am Gemma, ito na lang if this is your tanong, this is the sagot ha. Kung sakali pong pumutok ang ugat, I'll just address one issue of pumutok ang ugat. One of the most common po na pumutok ang ugat ay sinasabi po nila yung sa brain, which is actually a stroke, which is actually po in the US or in English, it is called a hemorrhagic stroke. There can be small hemorrhagic strokes, there can be big hemorrhagic strokes. Pag big hemorrhagic strokes po, these are called, marami pong they could be called subdural hemorrhages or yun po. Marami po dyan is due to high blood pressure. So, for those na natatakot po na may pumutok na ugat sa utak, may pumuputok po na ugat sa dibdib, may pumuputok na ruptured aortic aneurysm, yung namatay na stewardess, pumutok din na ugat noon. So, I'm just doing aneurysm sa brain. Okay, majority of them are due po to high blood pressure. This question can be answered a million ways. So I'm just tackling po one small portion of it, and I'm going with high blood pressure po causing hemorrhagic stroke. Okay? Sorry, hindi ko talaga mag-get. Hindi po dahil sa kulang yung tanong nyo, pero kulang po ang translation po sa ating national language.
From Miss Beth Taro.
Naintindihan mo ba yun, Reyna? Did you understand what I said?
Yes, Doktora, I'm 100% kumbaga parehas po tayo kasi mahirap po talaga. Actually, Doc, that's one of our struggle nung nag-nurse ako. Yung i-explain i-explain dun sa patient kung ano yung pumutok na ugat. Kasi nga po, when they say ugat, feeling nila
lahat hindi malinaw kung ano yung ugat eh.
Yes. They don't understand na pag pumutok ang artery, may ganitong effect. Pagka vein, may ganitong effect. So, different po siya talaga.
Pag malaking artery, ibang effect. Pag maliit na artery, ibang effect.
Yes.
And then, ibang effect pa yung artery all over the body. So,
yes.
Anyway, tinakal ko lang po yung most common The most common is high blood pressure.
Okay. Doc, from Miss Beth Taruk, Doktora, pwede na po ba akong pabakunahan para sa COVID vaccine ang may ganyan po?
Ganito po, Ito this is what happened to my cousin. Kwento ko na yung hindi ko kwento. But anyway, nagkaroon po siya, she's a breast cancer patient, nagkaroon po siya ng herpes zoster. Nung gumaling po yung herpes zoster niya, within 1 week po, nabakunahan siya ng Sinovac. So, I'm just sharing what happened.
Doc, punta na tayo sa mga bumabati.
Alberto, how are you?
Yes, from Doc Tina. Hi, Doktora Ana.
We need Doc Tina kasi wala akong alam sa mga bata.
From Miss Shane Andalio. Hello po, Doktora.
Shane, magandang umaga.
From Mr. June M. Todinho. Good morning po, Doc.
Hello, Sir June.
From Miss Viron S. Carlos. Good morning po.
Viron, magandang umaga.
From Miss Colleen Candice, good morning po, Doc Ana, York Bondoc.
Colleen, I hope nasagot ko yung tanong mo.
From Miss Beth Taruk, morning po, Doktora, watching po.
Hi, Beth.
From Mr. Remedios Nogoy Jeronimo, morning po, Doktora.
Thanks, Ma'am Remedios. Thank you and good morning.
From Miss Gemma Abaricio Saturay, okay po, Doktora, salamat sa sagot.
Thanks, Ma'am Gemma. I'm sorry, parang baka hindi ko natuldok maganda. But the most common cause po ng pagputok na ugat sa ulo is high blood. So, sa mga tao po, no, it's very sad na madiscover mo lang na may high blood ka pag may pumutok ng ugat. So, if you do have high blood, please manage it. Kasi talagang, ito lang that people don't know about, Rina, no? We try to think of high blood mostly as problem sa puso. Okay, tama ba ako? We try to think na
Tama
bad sa puso yung high blood. Tama?
Yes
Am
po,
I correct in
Doktora.
that, ano? Okay.
Tama po
So
kayo.
what we don't know is that high blood also has two other consequences which we actually discussed today and last week. Today, binanggit ko that high blood is one of the most common na pagputok na ugat. It is actually called the hypertensive bleed. Okay? Hypertensive bleed sa utak po yon. The second consequence of high blood na people don't really know is the talk with Dr. Dondo Corpus last week. One of the things that Dr. Dondo, tumatak ito sa utak ko we try to think of dialysis and kidney disease as coming from diabetes. And that is actually the number one cause ngayon sa Pilipinas. But what we do not give focus on is that the second most common cause of kidney disease and dialysis in the Philippines is, guess what? High blood pressure. Okay? So high blood
Agree.
pressure affects almost all organs din po ng katawan natin kasi it's a blood vessel problem eh. So natetension po yung blood vessel natin all throughout. Pati mata natin may issues eh. So heart, ito pong stroke and hemorrhagic bleed sa utak, and number 3, dialysis sa kidney. Yun po talaga yung 3 main issues that will happen with high blood pressure. Na parang kuminsan hindi tayo totally aware.
Okay, Doc. May isang pahabol and then I guess that's all. That we have for today. From El Ignacio Lacap. Doc, bakit 2 times na CT scan dapat kapag may bato ka sa bato?
Baka naman yung before and after, sir. I mean, that's the way I see it. Baka naman you were diagnosed with the bato, no? And lasted the bato. And then, na-CT ka naman to find out kung meron pang bato or wala na. Yun ho yung naiisip ko.
Okay. That's all that we have for today, Doktora.
So magandang hapon po to everyone. It's lunchtime. Enjoy your lunch. And sa mga may herpes zoster po, don't lose hope. May gamot po yan. Antivirals and of course pain control. And the most important po, if you have kids, pabakunahan niyo po ng chickenpox para hindi na po as they get adults, won't get herpes zoster. Maraming salamat po. Maya Pagtu po kay Kongan.